Hello everyone, Dr. Jesse Houghton here. Today I'm going to talk about a very controversial and at times confusing topic. Namely, is it safe to take PPIs, Protonix, omeprazole, Prilosec, Nexium, etc. long term? Nearly every day I have a patient tell me that they stopped taking their PPI because they heard or read about a side effect of long-term use. Or they tell me that their primary care provider or kidney doctor told them to stop taking this medication because of possible side effects. These possible side effects have included an increased risk of C. diff, kidney disease, dementia, bone fracture, gastroenteritis, stomach cancer, pneumonia, and vitamin and mineral deficiencies such as iron, calcium, magnesium, and B12 deficiency. Now, there are many observational or retrospective studies showing that PPIs are associated with an increase in one or more of these risk factors. However, observational and retrospective studies cannot determine causality, meaning these studies may show an association between PPI use and dementia or PPI use and bone fractures. However, they can't prove that PPIs cause these problems. For example, perhaps patients who take PPIs long-term have more medical problems in general, including GERD, and so are also more likely to develop dementia and fractures and kidney problems. To give you another example, patients with obesity, which is very common, are known to be at increased risk for more medical conditions such as cancer, heart disease, and diabetes, which also increases risk for a multitude of problems in and of itself. Well, obesity also increases the risk for GERD by several mechanisms, including by putting pressure on the stomach. And so, obese patients are more likely to be on PPIs, as well as also get cancer, heart disease, and diabetes. But you can't then conclude that it is the PPIs that cause the cancer, heart disease, diabetes, etc. Does that make sense? Contrary to these observational studies showing these increased risks, there is a randomized controlled trial, which was done in 2019, which showed that there was no increased risk of pneumonia, C. diff infection, gastroenteritis, fractures, gastric atrophy, which is a precursor to stomach cancer, chronic kidney disease, diabetes, COPD, dementia, cardiovascular disease, cancer, and hospitalizations. This study was conducted over a period of 3 years, and so provides safety data for patients taking PPIs for up to 3 years. Here is the study included. Now, the overall standard message that I tell my patients is, if you need a PPI for legitimate reasons, such as refractory GERD, erosive esophagitis, a history of bleeding ulcers, Barrett's esophagus, then it is safe to take them long term, as far as we know. Conversely, if you don't need a PPI for various reasons, such as heartburn symptoms or stomach pain, then try to taper off of them and see how you feel. Or see if you can switch to a less potent acid blocker, such as Pepcid, Zantac, or famotidine. I do recommend that you consult with your GI doc or your primary care provider prior to making this decision, as you may not be aware of previous findings on your endoscopy that may require you to stay on your PPI. Well, I hope this helps. Until next time, be well everyone.